Fast facts: Kybella and CoolMini are non-surgical procedures to eliminate excess fat underneath the chin. Both procedures are relatively safe with few side effects. Treatments with Kybella and CoolMini last less than an hour and generally require a handful of sessions. A doctor must administer both Kybella and CoolMini. Kybella and CoolMini both effectively remove fat under the chin. Both Kybella and CoolMini are non-surgical methods to reduce the layer of fat under the chin. Kybella is an injectable treatment that eliminates fat and removes it from your body. CoolMini freezes fat cells to reduce fat under the chin. These treatments can reduce under-chin fat within months and cost a few $1,000s. Both treatments require administration by a doctor trained in their use. Recent research studies have concluded that these procedures are an effective way to reduce extra fat under the chin. Comparing Kybella and CoolMini: Kybella and CoolMini are both non-surgical cosmetic procedures. In 2017 and 2018, non-surgical fat reduction procedures like Kybella and CoolMini were the third most popular non-surgical cosmetic procedures in the United States. Kybella. The Food and Drug Administration, FDA, approved Kybella in 2015 for effectiveness and use on excess fat in the submental area, under the chin. It's an injectable form of deoxycholic acid, DA, that can target the fat tissue underneath the chin. DA gets into cells and eliminates their ability to hold fat. Your doctor will administer Kybella by injecting DA underneath the chin in small doses. The typical number of injections given during a visit ranges from 20 to 30, and up to 50. Kybella works on its own and doesn't require additional procedures or medications to work. For comfort and to help recover afterward, you might be advised to apply ice to the area after your injections and to sleep in a slightly elevated position for a few nights. You're likely to see full results within a couple of months after several treatments are done. Swelling goes down, and your skin is able to tighten up. CoolMini. CoolMini is shorthand for a non-invasive procedure that targets fat under the chin. CoolMini is actually the name of a clinical device designed specifically for cryolipolysis applied to the underside of the jaw for what's commonly called double chin, also known as submental fullness. It was approved for use on submental fat by the FDA in 2016. This procedure cools about 20 to 25% of fat cells in the targeted area. Eventually your body eliminates these cooled fat cells. The fat cells treated do not come back later. Your doctor administers CoolMini with the special applicator at the area you want treated. You will feel a cooling sensation at first during treatment, but that sensation will go away. During treatment, you can engage in a quiet activity like working on your computer or reading a book. Your doctor will massage the targeted area for a few minutes after treatment. You should be able to resume normal activities immediately after your appointment. You do not need to have any additional procedures or take any medications with CoolMini treatment. Reduction in fat cells under your chin will become noticeable a few weeks to several months after treatment. According to the manufacturer, you will see the most significant changes to the treated area after 2 months. You may also require multiple treatments depending on desired results. Comparing results: studies examining the results of both Kybella and CoolMini show significant positive results of these non-invasive surgical treatments for excess fat under the chin. Kybella results: one recent study reviewed all human studies of DA injections in the chin area. It concluded that treating chin fat with DA is a non-surgical procedure that leaves patients with a positive self-image. Another study, trusted source on the effectiveness of DA treatment, concluded that patients are satisfied by the treatment and that professionals see improvement in the lower face. CoolMini results. A review of 5 studies on cryolipolysis concluded that the treatment reduced fat under the chin in satisfied patients with minimal side effects. A small clinical study trusted source of 14 people showed a reduction in fat underneath the chin and minimal side effects from cryolipolysis. Before and after pictures. Who is a good candidate? Kybella. People who have a medium to large amount of fat under the chin are ideal candidates for Kybella. Kybella is only intended for people over age 18. There is a lack of research on treating those who are pregnant or lactating. People taking blood thinning medications should discuss Kybella treatment with their doctors before proceeding. CoolMini. Candidates for CoolMini must have noticeable fat under their chins. People with all skin types can use CoolMini. You are considered an ideal candidate. Trusted source if you have a healthy weight and are in general good health. People are not candidates for CoolMini if they have cryoglobulinemia, cold agglutinin disease, paroxysmal cold hemoglobinuria. Comparing costs. In general, cosmetic procedures are not covered by insurance. You'll need to pay for Kybella or CoolMini yourself. The cost of the treatments will include the procedure as well as its administration by a doctor. Both Kybella and CoolMini will cost a few $1,000s over the course of treatment. Costs will usually depend on your doctor, your location, the course of treatment, and your desired results. Kybella costs. Your doctor will discuss the expected treatment plan, what they think is achievable, and the potential cost and length of each session. You will likely need multiple sessions for results. Sessions are only 15 to 20 minutes at a time and do not require you to take time off of work beyond the treatment itself. According to the American Society of Plastic Surgeons, ASPS, 2018 statistics, the average cost of a Kybella treatment is $1,054, not including other fees and considerations for personalized treatment. CoolMini costs. Like Kybella, the costs of CoolMini are dependent on many factors. The CoolMini procedure can last up to an hour, and you'll likely need multiple sessions to achieve desired effects. The Cool Sculpting website states that treatments generally range from $2,000 to $4,000. The ASPS statistics for 2018 estimates the average cost for a non-surgical fat reduction procedure, such as Cool Sculpting and liposonics, to be $1,417. Comparing the side effects and risks. Both treatments have some side effects and risks associated with them. Talk to your doctor before beginning treatment and be open about what other medications you're taking and your surgical and cosmetic procedures history. Kybella. The most common side effect of Kybella is swelling, which can also cause difficulty swallowing. Side effects near the injection site may include redness, swelling, pain, hardness, warmth, and numbness. Other side effects may include bruising, alopecia, ulcers, or necrosis near the injection site. You may also experience headaches or nausea. In rare cases, this injectable treatment can cause nerve injury and difficulty swallowing. Nerve injuries may result in an asymmetrical smile or muscle weakness. Speak with your doctor if you experience any of these side effects. People taking blood thinners should discuss Kybella with their doctor, as these medications increase the risk of side effects. CoolMini. The side effects for CoolMini may include sensitivity near the throat, redness, bruising, swelling, and tenderness. You may also experience stinging, aching, or itching after the procedure. Most side effects from CoolMini last only a few days or weeks following the procedure. One rare side effect of CoolMini is adipose hyperplasia. This condition occurs more commonly. Trusted source in males. Kybella vs. CoolMini chart. Kybella. CoolMini procedure type: non-surgical, injected non-surgical, Applied on the skin surface cost an average of $1,054 per treatment, an average range from $2,000 to $4,000 depending on the number of treatments. Pain results from injections into the skin. You could have up to 50 injections per visit. You may experience a cold sensation and tingling in the first few minutes of the procedure before the skin numbs. Number of treatments needed: no more than 6 sessions lasting 15 to 20 minutes in length, 1 or more sessions lasting an hour in length. Expected results: permanent reduction in fat under the chin. Permanent reduction in fat under the chin. This treatment is not recommended for people taking blood thinning medications and people who are pregnant or lactating, people with cryoglobulinemia, cold agglutinin disorder, or paroxysmal cold. Hemoglobinuria recovery time: a few days to a few weeks, hours to days.